Hello, I'm Dr. Rajini Muthineni. I'm gynecologist from Care Hospitals. Now I am with Dr. Manjula Anagani, the Padma Shri Awardee, senior most gynecologist and the most happening gynecologist with us. So she is going to answer us about few concerns regarding the latest change from PCOS to PMOS terminology. Hello ma'am, good morning.
Hi Rajini.
Ma'am, we already know that PCOS is the most common condition
True.
affecting women. So now we have been hearing about, there is a lot of discussion about this in latest terminology, PMOS.
Yes.
So can you please enlighten us about this?
See, when we were talking about PCOS, we were concentrating more on ovary. We were only talking about in the scan, we have polycystic ovary disease, which might not be any significant. Ovaries might be having cysts for any other reason. But when we talk about PMOS, we are talking about the actual syndrome, which we've been trying to, it is like who will bell the cat. We've been trying to tell the people and the doctors about the awareness about the syndrome called polycystic ovarian syndrome, where so many things can happen. When awareness hits a block, we need to tell them in a different language. So PMOS came up. What is PMOS? It is Polyendocrine Metabolic Syndrome. So ovarian syndrome. Still we are talking about ovary because the origin is the ovary, but the end point is not ovary. So when we talk about endocrine, we know why it starts at one place and everything, every tissue, including the hair, skin can be affected. That is the reason, that was the need of the day, that the awareness spreads and people start taking it more seriously than they were taking, because it is like, oh, it's okay, every other girl is having it. Rather than that, if we don't take care of it now, in the future, life expectancy and all the other diseases of metabolic syndrome like hypertension, diabetes, cardiac disease, and more importantly, at an early age, endometrial cancers.
Yes,
so this terminology had to be changed, so it is changed.
So why this shift, ma'am? What was missing in the earlier definition?
See, earlier definition, when we talk about PCOS, we were only talking about ovary. In ovary it is there. So the parent in a young girl comes to us. See, we know that PCOS can come in any time of the thing. But origin of PCOS was always with the stress. It was about the 7th, 8th class girls who were studying for exams, who were put a lot of stress, were undergoing all these adrenarche changes, which later led to the pubarchy, thelarchy and menarche. By that time, there were changes happening in the hormonal system, which leads to irregular cycles. So in that age group, when more important is the irregular cycles, people were only thinking about, it is only irregular cycle, why should we be bothered? It's okay, let her study. Then when the acne came, hyperandrogenism, then when pimples and abnormal hair, we will go to dermatologist and we will take care of that. Then when this pigmentation started happening, then they understood about insulin resistance. Still there was a lot of resistance. When we start telling them, you need to take these medicines which will decrease the insulin, it is like, how can you give a diabetic medicine when the blood sugar is normal? So this is a sort of a resistance we had from the public and the awareness which was lacking. That was the reason why there was a need. That is the first thing. Second reason why there was a need, a girl would go to a gynecologist if irregular cycles are there. If there is an infertility, they would go to a gynecologist. Yes. They would go to a dermatologist if there is something else. If there is a diabetes endocrinologist. So they were going to different doctors and different treatment. They were thinking they're all different diseases. So to get an awareness that this is a part of the whole thing, and whether any doctor treats, we are all on the same page.
Yes.
This is the reason we had to do. Third reason why it had to be changed was so that it is on the same page, so that we can do a research, collaboration and everything, and we can correlate our findings.
Yes.
So the name had to change.
So PMOS reflects a most holistic understanding about the situation.
Absolutely. Yes. We need to understand, even though you're going with a hyperlipidemia, even though you're going with a diabetes, pre-diabetic situation, even though you're going with hyperandrogenism and all, it is still the same disease. So you need to understand that we have to treat this disease as one, rather than tube-line thing. I have headache, I'll go to neurologist. I have stomachache, I'll go to gastroenterologist. No, this whole thing is the same. So holistically it has to be treated, and it has to be with either an endocrinologist or a gynecologist who is the first one to see the girl.
Yes. So it's not only about the cyst or irregular periods, but it's much more beyond that.
Absolutely, it is beyond that.
So what are the most common symptoms, ma'am, that a woman should watch out for?
See, people might not have everything. Everything, it is not the whole spectrum should be there in everybody. See, that is the reason why we had a Rotterdam criteria, even though many PCOS criteria and American criteria, that criteria, so many criteria came. But still we all stick to Rotterdam criteria because it was much more easier. Yes. It is like 2 out of 3. Scan picture of ultrasound, or biochemical thing of hormonal changes, or you have a hyperandrogenism or insulin resistance, or you have a symptoms like, this is where we come, irregular cycles, or putting on weight and you're not losing weight in spite of you doing so many things. You take care of your diet, you're doing exercises, still you're not losing weight, and you have lot of pigmentation around the neck and in all the creases. Then you have pimples and abnormal hair. So it can be all these things. So when you have any one of it also, along with an ultrasound picture or a biochemical change, which when we evaluate, it is still in the same spectrum. It is a spectrum starts from this to 360 degrees. Yes. You might be anywhere. It can be A, B, C, D, E, F, G till Z. It doesn't mean that you should have everything before you start treatment. So symptoms vary. Yes. From irregular cycles to infertility to anovulation to abnormal hair to pimples or acne,
but
what we call.
Most of the women usually they ignore these symptoms. So why do you think they ignore all this? What are the warning symptoms that one should not ignore?
See, first thing is we all tend to have normalized things. We are like, it's okay. But after marriage, you will put on weight. After this, you naturally have irregular cycles. During menarche, irregular cycles. Post-delivery, things you should not neglect. First is when you have irregular cycles with bleeding which is beyond the limit, because in even 25-28 years we see endometrial cancers. Yes. So irregular cycles more than 2 times. First time you have irregular cycle can be because of stress. Second time it's okay. But it's still having irregular, like not getting periods only with withdrawal. Only you get periods only after taking medicines or something like that. Or 3-4 months you don't get and you start bleeding and continuously bleed. Should never neglect. Second, you're putting on weight and it's not coming down, your blood pressure started increasing, and whatever you do, it is not leading. You need insulin sensitizers.
Yes.
Otherwise, you will never put on weight, and obesity itself is a high risk. Your quality of life, mortality, morbidity for any procedure you undergo is going to be affected. So these are few things. You can, acne, abnormal hair can be an aesthetic sense, but obesity is a completely a no-no, because it can lead to metabolic syndrome affecting the hypertension, diabetes, cardiac diseases, and even endometrial cancer. Irregular cycles is something, and abnormal bleeding is something, and infertility is something. Please do not neglect this.
So how can we manage this PMOS as on today?
See, first thing we should understand, any lifestyle disease, like I said, this is a lifestyle disorder because of it is being precipitated because of the stress we give and the diet we take, and the pouch potato syndrome where we are not doing exercises. Any lifestyle diseases is a lifestyle change for life. So we need to understand the first 3 things we tell the patient is, first thing is de-stress yourself. You have to be, it depends on individual person. They can do dance, they can do music, they can listen to music, they can gossip, whatever they want. Second is, change your diet in such a way that you decrease your carbohydrate and increase your protein. Third, when we talk about exercises, it is not just walking or yoga where they're flexing. They are very important for circulation. But we need to look at every muscle which has insulin receptor to contract. So you need to do a physically like aerobics, skipping, cycling, this sort of a gym or these sort of the exercises which we tell. So these are few things which patient has to do lifelong. Then comes
most
medicine.
of the patients, they come and tell us that we are doing walking daily, but daily. Still why this PCOS is not coming
because
down?
Walking will not stimulate the insulin receptors. So these are 3 things are for lifelong. Medicines can be still temporary depending on your hormonal changes. So if the central hormones are erratic, we give OC sort of a thing, means oral contraceptive pill sort of medicines, which will settle the FSH-LH alteration. And if they want to become pregnant, we induce them for pregnancy. So this is about the hormonal changes. But if they have acne or abnormal hair, whatever has already come, they have to go to the cosmetologist or dermatologist to get their lasers done. But the inherent hormonal changes, we give the aldosterone, anti-testosterone medication so that the hormone from inside will be cut. But now the basis of the whole thing, the syndrome we are talking about, PMOS, is insulin resistance. So if we don't target insulin resistance, PMOS will never come under thing. So depending on the HOMA-IR, this is the test to be done, that is called insulin resistance test, and we are not bothered about fasting insulin, it can still be 80. But if the insulin resistance is high, you have to start taking insulin sensitizers. Most common medicines we give is the metformin, but now we have a lot of GLP-1s also. Depending on your weight and the obesity and the need of the insulin resistance sensitizers, we change the medicines. So all these things are needed, and they can be, medicines can be temporary, but lifestyle is for life.
Yes, ma'am. So
And it can only be controlled, Rajini.
Yes,
We can
ma'am.
never talk about cure at all. We
Yes,
can
ma'am.
control it
So this
completely.
is a common fear patients have. No, they keep on asking, will this stay with us lifelong? Is there any end to this problem?
If you make your lifestyle your daily routine, it doesn't become a burden. It will not end or start. Every day you do your exercise, every day take care of your diet, whichever you're having a plate, make it colorful, less white and more colorful, and de-stress yourself.
And what I noticed in patients is immediately, whenever we talk to them, they do it for a while and again they stop it. The consistency is the key. So they have to be consistent with whatever exercise and
Absolutely.
diet.
Like I said, no, it is for life.
Yes.
It's not temporary.
Yes.
Medicines will be temporary if you take care of your thing. So it is definitely be controllable.
So what is the takeaway message you want to give, ma'am, to the patients with PCOS?
I totally agree
PMOS.
that there is a lot of increase in PMOS and PCOS in the recent times. Apart from the stress, diet and exercise I've been talking, we should talk about pollution, which has caused the endocrine disrupting chemicals. So my take home message would always be never neglect any symptom. And please meet your gynecologist and make her your friend, and meet her every once in a year so that we can evaluate and rule out any other problems which we have. Take care of your diet, de-stress yourself, do exercises. But when we talk about pollution and we talk about plastics, I want to take this 1 second to talk about No Pop campaign, that is no plastics over the privates, so that the plastics nearer the privates will cause increased endocrine disrupting chemicals and disrupt the hormones which are there.
Yes.
So change over to either menstrual cup or to the organic sanitary napkins or organic tampons or pre-read panties or cotton sanitary napkins. So take care of yourself, you take care of yourself, your family is going to be healthy and whole of country is going to be healthy.
Yes, ma'am. That was really a great interaction with you, ma'am. You gave so many insights about this condition. So all girls out there, whenever you are facing any irregular periods or weight gain or acne or hair growth, please don't neglect these symptoms. They may look simple, but they can lead to many other issues. So please immediately meet your doctor, get yourself evaluated, and please take treatment on time. And consistency is the key. If the doctor advises you regarding diet, exercise, lifestyle management, please make it consistent and just don't do for 1 or 2 months and just stop it. And be consistent in checkups with your doctor. Thank you. Thank you, ma'am. Thank you so much.
Rajini. It was a pleasure talking to you.
Thank you, ma'am.